long does it take to heal knee pain from patellofemoral pain syndrome? Well, most doctors will tell you that it takes 1 to 2 months to recover from patellofemoral pain syndrome. But what they aren't telling you, because they're not experts in this, is that that's the amount of time that it takes to get the pain to calm down. And they're usually having you take pain medication and rest it, not do the activity that's led to this point, so that you can get the pain to calm down. But that's really just step one in the whole process to fixing patellofemoral pain syndrome. Now I'll tell you more about the process, but let me just go back to that resting it, that first phase, because when you're resting it, you're usually told to take it easy. Maybe if it's really bad, get on crutches, stop playing the sport that you're playing that's aggravating it. And in doing that, you're no longer aggravating the knee joint. You're not pushing the kneecap up against the thigh bone and causing irritation behind the kneecap. And so it's going to calm down. Very much like if you had a cut on your skin and you babied it, you put a Band-Aid on it, you made sure not to bump it anywhere, you protected it, you shielded it, it's going to heal very fast. Versus if you don't put a Band-Aid on it, if you don't shield it and you keep scraping it on things, you're going to be peeling off that scab and re-injuring it over and over again. And this is what often happens in people with patellofemoral pain syndrome, is they go back to the sport, they go back to exercise too soon and re-aggravate it. The pain comes back, the swelling might come back, and it stays irritated for weeks, months, for some people even years. And that's what sets them up for a really bad situation. But if you rest it and you maybe take medication if you need to, if you do all the things that you need to do to get it to calm down, then you can get into a position where you can address the real problem. Because the real problem is a muscle imbalance. The root cause of patellofemoral pain syndrome isn't that you did too much activity. It's not that you like to do jumping sports like basketball or volleyball, or that you run a lot and you do marathons, or you're in cross country, or you do 5Ks, 10K. It's not that. It's that when you go do those activities, you're using the wrong muscles. You're compensating. And it's not something that physicians are usually aware of. Even surgeons don't think about this. Surgeons are trying to look to see inside your body with MRIs and X-rays what they might fix that's broken. But in patellofemoral pain syndrome, the X-rays are usually clean. The MRI looks fine, just a bit of swelling, nothing that's operable. So surgeons aren't the best person to help you in this situation most of the time. You need to figure out where the imbalance is, where the muscles are compensating, so that you can exercise correctly and eventually return to your sport using the right muscles with the appropriate pressures going through your joint, so that it's not aggravating your knee. It is possible, in every case I've seen, to heal from patellofemoral pain syndrome and get back to full speed sports, weightlifting, running, jumping activities, and not make your knees any worse, because your muscles are in the right balance and you're not overloading the kneecap on the thigh bone. Now, if you follow most doctors' advice, they're going to tell you rest it, take this medication. After a month or two, the pain calms down. If you stop there, that's where most healthcare stops. They'll say, you're healed, pain's gone, great, go back into sports, you're done. It's just a matter of time before you get back to full speed, you get back to that exercise that maybe hurt you in the past, and your knee pain comes back. That's why it's not fully fixed and you're only in the first phase of healing the problem. Now, I often get the questions, why don't doctors know this? Why don't physical therapists know that? Why do they just stop there? And I gotta tell you, it's related to their schooling. When they go through school, through medical school, through physical therapy, nursing school, through all the healthcare schools, they get taught how to use medications, how to give injections, how to do surgeries. And if you're an exercise specialist like a physical therapist, you get taught how to help people after they have a surgery, how to get them to recover from a surgery. What they don't get taught, what there is almost no emphasis, probably zero emphasis in many programs, is how to prevent the problem from beginning in the first place. How to treat the root problem. The idea of a muscle imbalance is never spoken in all of these schools. So if you're going to go see a healthcare professional for your patellofemoral pain problem, don't be surprised if they offer you pain medications, tell you to rest it, and say, give it a month or two, you'll be good. You need to know, I'm educating you right now. I want you to walk into those situations with the right expectations. You need to know that that's just part of the problem. You're going to get the pain to calm down, great. Next comes the work of fixing the muscle imbalance. which comes back to getting your glutes stronger. There may be some foot things to work on. You may even need to work on your core muscles in your abdomen in order to make sure that the pressures going through your knee joints are best suited for what it's designed to take, so that you can go play at that high level, or even just go work on that everyday level just to stay fit without your knees slowing you down and keeping you from doing what you want to do. This process of fixing the muscle imbalance usually takes anywhere from a month after it calms down to 6 months, and in some cases, if you're very weak, if you're very overcompensated, then it can take even a year, or the better part of a year, to get the root problem addressed. But think about it. If you can do that, if you can fix the root problem and learn how to use your muscles properly in your favorite sport or exercise or activity, then you have a whole lifetime ahead of you of excellent knee health, rather than the alternative, which is get it to calm down and feel better, but get back to it and then run into knee problems again. And then do that every so often, every few months, every year. And then eventually that problem festers and you end up with a meniscus tear or knee arthritis, and you end up having some surgery. You end up with just a slew of problems that come on as the years go by. Talk to people older than you with knee problems. Maybe you have a family member and they'll tell you, oh yeah, I've been dealing with this knee problem since I played sports in high school. Then in my 20s this happened, then in my 30s that happened, then I had a surgery, then I had knee arthritis, now I had a knee replacement, and I still have problems even after my knee replacement. I don't want that for you. Now in your younger years, if you can address the root problem, you can get to your 70s, 80s, and beyond and feel fantastic in your knees. It only takes about a month to get the pain to come down, and then it only takes a few months more, 3, 6 months, on the longer end, 12 months, to solve the root problem and make sure that you're good for the rest of your life. If you're looking for help on solving the root problem, on going through the right treatment approach to fix patellofemoral pain syndrome, I've got a bunch of videos here on YouTube. You can check down in the description below. There's a patellofemoral help playlist, and I've also got a program called the Patella Pain Recovery Program. It is my comprehensive treatment approach, step by step, in over 30 videos where I guide you through what to do to get your patellar pain down under control, and then fix the root problem, and even train into high-level activities safely and confidently that you're not going to hurt your knee again, so you can do whatever you want and live your life into your late years no matter what. Go check that out in the description below. You're going to benefit so much from it. Hey, if you thought this video was helpful, please give us a thumbs up. Please share this with somebody you think needs to see this. And don't forget to subscribe to our channel and hit the notification bell so that you catch all the videos we release each week. And please drop comments on here if you have questions. We love to point people in the right direction. Sometimes they're looking for a specific video, or maybe you have a chondromalacia patella problem, not really a patellofemoral pain problem, or you have tendonitis or bursitis, or maybe you have a meniscus tear. We can guide you in the right direction. Just drop a comment, leave us your story. If we've helped you in any way in our other YouTube videos, please leave us your story. We love to hear testimonials in the comments. It just makes our day. Guys, thanks so much for watching. I'll see you in the next video. Bye-bye.